What is happening, you beautiful bastards? Welcome back to another week. This week's guest is Kate Wallinga. Kate is a forensic psychologist, and we have a fantastic conversation with her, ranging from it's amazing to talk to serial killers to all sorts of other crap.
Yeah, it was a wild time. I think you guys are gonna like it. And kind of a summary of what she does is she is, as Grizz stated, a forensic psychologist, but she's not profiling. What she did was when you hear about someone who has to go to jail and they plead insanity or they're just really messed up people, they have to go to a court-appointed psychologist to be evaluated to see if they're fit to stand trial. So a lot of what she was doing was evaluating these people who violently killed people, just tried to plead insanity, even though they were perfectly sane and knew.
I would say there was a lot of the figuring out if people were bullshitting or not, and she knew 90% of the time.
Yeah, apparently it's pretty obvious if you're not crazy and you try to pretend you are. But we actually go all over the place, from what she saw while she was on that side of the fence interviewing these people who were pretty messed up, to her own journey with interesting mental health circumstances. But I'll let you guys listen to that and see what you think of it.
What is happening, you beautiful bastards?
Yeah, who are you?
What's your name?
I just had a stroke. Make it up, I'm Batman.
I was going to say, it could be anything right now. So anyways, you do forensic psychology, correct?
Yes, I'm on disability now. As we discussed before, I have a whole lot of medical stuff, and I kind of kept metaphorically falling down and picking myself back up again. And then in 2014, I literally fell and broke my back. And that was the limit. That was where I couldn't, because to do forensic psychology, to do crisis work, which is what I did, you need to be pretty mobile.
How did you break your back? It just fell?
I have a autoimmune disorder, which is at the heart of a lot of my health stuff. And it's called ankylosing spondylitis, which is a fancy name for my body thinks I need a second spine.
Okay.
So it starts from the tailbone and works its way up, and it fuses.
Weird.
Is there a fix for that?
No.
Okay. I was going to say, what are you going to do? Remove the other one? Like,
right? It's the people who you see, elders who walk at a 90-degree angle permanently.
Yeah.
That usually is what you should picture. The people who cannot stand up straight anymore. That's what I have. I could take immunosuppressants, which would maybe delay progression, but there's nothing so far that will treat it. And I have 4 children, which means a lot of germs in my house. So I'm not going to get on an immunosuppressant. Like, that's not a smart thing.
Yeah, no, kids are bad enough as it is.
Kids just suck. Like,
it's true.
Yeah, we talked about immuno stuff before, because I also have an autoimmune disorder or disease. I don't even know what to call it anymore. I have a different set of symptoms because, as you probably know, people with autoimmune issues can go any direction. I won't take anything that suppresses my immune system either. It's just a terrible plan.
It's, if I lived maybe alone with someone who was able to avoid a special exposure to a lot of other germs, even before COVID, exposure to a lot of germs and ailments, then maybe. But my husband is a college professor, which means he deliberately goes out in the world and not exposes himself. Let me reword that.
Nope, it's already been said.
It's been said. That's fine. It's, it was going to come out eventually, as it were.
It's true.
And he's deliberately around people who are potentially germ-ridden. We live in Boston, which...
Oh, you're not even that far from us.
Boston is inherently germ-ridden. I love it. And with 4 kids as well, it's just there's no possible way
No, not at all.
to really limit my exposure to things. And so the answer instead is I'm gonna stay home. And
Yeah.
I'm not gonna take immunosuppressants, and I cannot get the flu vaccine, but I could get COVID vaccine. So that's good.
How did the COVID vaccine go for you? Because when I got the second shot, when they tell you the second shot, it's a 14-day period before you're fully vaccinated afterwards. I was sick the entire 14 days.
It's true.
The first vaccine, I spent maybe a week thinking I was about to die.
Mm.
And then I spent the second week hoping that I was about to die because I was so sick. I was so miserable. And I was among the first wave that was approved. And so we were still on lockdown. And so it was pretty easy to just close my door and growl anytime somebody opened the door. And that was fine. The second vaccine, really nothing. Really fine. And the booster was fine.
I haven't gotten the booster. It's unclear for me. I don't even know what I'm supposed to do with that. I should probably take better care of myself. But
I think they're saying you need to get it now. Now they're just saying go get it.
I'm not looking forward to it. I probably should though. But anyway, what is forensic psychology for people who think it's just a mentalist?
It kind of is. I guess it's really just, and I use just in visual quotes, but it's psychology that has to do with the criminal justice system.
Okay.
So sometimes I worked inside a prison after somebody had already gone through the whole process and been convicted and everything. And I would do check-ins, intakes. I would do crisis evaluations, whatever.
Now, like, so once they've made it into prison, what would a forensic psychologist do? Because if they're already in prison, well, I guess they might not be actually like drawing a blank here. I can't even speak. Maybe I'm having a stroke.
It's possible. I mean, we've all been there.
They might not be charged with it yet, right? So
if you're in prison, you've already been charged and convicted. Jail is pre-conviction. Prison is post-conviction.
Okay.
And
I was thinking about
I would occasionally go into jails to see somebody. So, okay. When I worked in the prison, that was more sort of maintenance. That was doing the rounds, checking in on people. If somebody seemed like they were having a manic episode or a psychotic break, then I would kind of help figure out, like, what do we do here? What's this? What's going down? And as well, I did the intakes for everybody new that came into the prison, because sometimes you can scoop them up quickly enough to talk to them before they realize that they should tell everybody that they have ADHD so that they can get speed.
Oh, yeah.
Interesting.
Because Adderall has very high street value, including on the rec yard.
Yeah.
So we tried to scoop them up and get them to admit to us that they've never been diagnosed with ADHD before having time to talk to their cellmates. So that was the prison. And I would also do, if you have been diagnosed with something fairly major in prison, then every so often, 1, 3, 5 years, depends on the person, you have to be reevaluated to make sure that your symptoms are fairly stable and your meds are basically working, or that you're adequately cheeking your pills and selling them to your cellmates. Like, that's kind of beyond my role. I also did forensic assessments, which is before they are convicted. That's to figure out competency to stand trial. It's to figure out what your diagnosis might be, and it's to offer my opinion about what should happen next. Now, where should they be housed?
Going into prison for you, was that like kid in a candy store, or is that like a nightmare as far as like seeing all the different, mental health?
Neither.
Really?
I mean, I felt more respected working in the prison than I have at literally any other job I've ever had.
Is that respected by, like, I guess, what, your patients? Is that what you mean? or just in general?
Clients, yeah, the inmates,
Okay.
but also my coworkers and everything, because it was a state prison for men, and they know that you don't touch staff. That within prison there's its own court, sort of, that happens. Like there are an extra run. You can get years added onto your prison sentence for spitting at somebody, that kind of thing. So you don't staff, especially women. And so I got a lot of super polite people. Plus, there was no benefit to them to mess with me. So that was fine. I also worked in locked psychiatric facilities around Massachusetts, and that was fascinating.
Fascinating how?
Sometimes hilarious, and sometimes dark, and sometimes pathetic.
Yeah, and pathetic in what care they get.
Well, yeah, and there was one guy in particular comes to mind who had been diagnosed with paranoid schizophrenia, had been in the system, either mental health system or criminal justice, or sometimes both, for, probably 30 years by that point. I cannot imagine he's still alive now.
Yeah.
And so this was 20 years ago. And he basically spent his entire adult life in the system. And the assumption was, and I was never able to really parse out why, but the assumption was this is an adult male with early onset schizophrenia. Turns out he was deaf.
That was the situation the whole time?
Yes. But the problem is some of the older generation schizophrenic meds create symptoms. It's a network of symptoms. The fancy name is tardive dyskinesia. It's facial expressions, its tendency to drool, or what we call a tongue thrust, which is a lot less sexy than you think it is, and an inability to show or even experience emotion. There's this whole network of it. And once you get tardive dyskinesia from having been on these meds, you have it.
Oh,
They're
really?
just now coming out with some drugs that they think maybe might help, but they're not really sure. So here, take another pill. Why not?
That's brutal.
So this guy has tardive dyskinesia. He can't experience emotion. He can't communicate. And also he's deaf, and nobody ever taught him how to sign or even explained to him what hearing means.
For 30 years. That's brutal.
Yeah.
And I know a lot, and especially years ago, the treatment in those places is not amazing. So many people get thrown in there not knowing what the hell is going on. Either they're autistic or whatever. And it's just, it's a shit show.
Have you heard of the movie The Titicut Follies?
No.
It's horrifying and fascinating and amazing, and I feel like it should be required watching, especially if you live in any place where they still have a state psychiatric facility, which Massachusetts. So the state of Massachusetts had this terrible, terrible reputation. This is in the 70s for mistreating their patients in their hospitals. So they hired this guy named Frederick Wiseman, who was a pretty noted documentarian. And they said, we'll give you a year and a camera. Spend your time in Bridgewater State Hospital, which is south of the city. It's where they kept Albert DeSalvo, for instance, the guy who was technically called the Boston Strangler, even though that's a whole other sideline for me. But it's both a psych hospital and a prison. At the same time. And they were like, just film what's going on and come up with effectively a promotional documentary for us. And
which is interesting.
No problem. And what he created proved that the conditions inside that hospital were worse than anybody ever imagined.
So it backfired on them.
It backfired hardcore. And the state of Massachusetts succeeded in suppressing that documentary for a solid 20 to 30 years. It wasn't until approximately 2005 that it became available to the public. And now if you have connections with Google and YouTube, for instance, you can find it out there, and it's disturbing and upsetting. And you're like, oh, this is the good the good version, no less. Like
he was
what-
trying to make this happy.
That stuff right there is like that's the kind of thing that comes to mind when I think about psychology in the 70s. Like it's just
Oh yeah.
it's nothing but horror stories that I hear about it.
Well, when I hear that, I don't think just Massachusetts. I think everywhere. It's just Massachusetts got caught for it, and they were stupid and made a documentary about it. Hey, we're getting blamed for some shit. Go film.
Go film. Prove we're not so bad. And this guy was smart enough
Wait
to
a
have
minute.
them sign a release of information like, whatever I film, you have to let me use. And they were like, it's fine. We're fine. It's fine.
Oh my god.
It's not fine.
That makes me wonder if they legitimately thought they were not doing anything wrong. They had to.
Probably the person who hired him thought they were not doing anything wrong. And the people, you know, the mental health aides or even the psychologists were like, don't do that thing. That thing that
Well,
you're
I
going to
also
do,
wonder-
bad idea. But by then, it's too late.
When you're working on something like that, when you're doing the stuff daily and stuff, you look and you're like, oh, that's not that big of a deal. But people who don't see that on a daily basis are like, oh my god.
Yeah.
For
What'd
real.
you do? You know?
Now, you had mentioned a couple of minutes ago the people in prison, I think it was, that are faking ADHD to get Adderall, right?
It's a good time.
Yeah, well, I don't know. That's another topic. But Grizz and I have actually disagreed on this quite a bit. I don't know the full scope of his view.
I'm an
What do you
idiot.
think about ADHD? Because I don't think Grizz thinks it's complete nonsense, but I don't think he's.
I don't think
on
it's
board.
nonsense.
To get technical,
Yeah.
it's a fucking nightmare.
Okay.
And I can say this because I started off my career running a learning disabilities ADHD assessment clinic in New Hampshire. And it was basically for rich kids because if your kid is in the public school system will do the assessment. But if your kid goes to a private school, and we were fairly close to a pretty well-known private school, then you have to get someone private to do that assessment. And turns out if you go to most graduate programs, the doctoral students are chomping at the bit to do the assessments, and it's significantly cheaper than going to somebody who already has a private practice. And so I ran that and I oversaw that. And I used to say things. I used to explain things to parents a certain way and explain things to kids. And I had sort of, I don't want to say a patter, but kind of a patter, you know. And nobody ever came back and yelled at me. So I was like, cool, guess I'm doing something right. And 2 of my children have ADHD. And so I've watched that and been like, yeah, it all tracks. It's pretty difficult. But these poor kids have a psychologist for a mother and an educator for a father. So they're stuck. Like, we're not going to let them, you know, pretend this is not a thing. And then when I was in my late 30s, I developed epilepsy. Out of the blue. Nobody knows why. I'm just super lucky this way.
Yeah, obviously.
Clearly. And the lesion that the epilepsy, the seizure created is in my right frontal lobe, which is where executive functioning happens in the brain. And executive functioning is your ability to form a plan, follow it through, and then assess how well it went, which is basically what ADHD is about, but that's also what OCD is about, and schizophrenia, and several other. There are a whole bunch of
They're all
disorders that kind of sit right there. And so I went from running a learning disabilities ADHD clinic to having it. I now have ADHD, and because this is cool, since ADHD medications lower your seizure threshold, I can't take them. So that which caused me to have ADHD now prevents me from taking the medications for it.
Fun.
I'm super fun.
I believe that ADHD is a thing, Jerry.
Yeah, I know. So
and
we've talked about it before, Grizz, and I brought it up because it's not that you don't think it exists. I think that we disagreed on things like the scope, because I have diagnosed ADHD. I don't take anything for it, as I'm afraid to, but
ADHD, I don't question too much. I think ADD is
There's no difference.
Is from what I hear. So you can tell me.
There used to be ADD hyperactive type and ADD inattentive type, but since the 90s, they've all been ADHD, attention deficit hyperactivity disorder.
So when we were kids and they were going nuts on it and they had the two splits, it seemed like they were just throwing ADD at everyone. And it was like they tell me I have ADD. No, I was
They told my husband he has ADHD. I was like, bullshit. That man is organized and
I'm organized as fuck. But the problem was
kills me.
when I was in school, I didn't want to pay attention to what they were saying. My teachers were boring.
Yeah.
You know what I mean? Like, so and that's a whole nother thing. But to me, how many people are like me who get lumped into that?
Yeah.
Because they were bored or their teachers. I don't want to blame teachers, but they don't get paid well. Like, it's hard for them to get enthusiastic about what they're doing so often and so much when they're dealing with kids and everything, all that bullshit. But so for me, I was just bored out of my mind. You know what I mean? If there was a class I wanted to pay attention to, I did great.
Well, you know what's interesting about ADHD is if there's a class you want to pay attention to, you can still do great. Like one of the things that I struggle with, like on a daily basis, is audio processing. I don't really understand the whole situation, but like if I'm at a drive-through with my wife and she tells me her order, I cannot repeat it.
Really?
Yeah, she'll say it like 3 times and I'll say, all right, it's this, this, and this. Got it. Turn to the window and say it completely wrong. I can't stop it.
In fact, lean back and make my husband shout over me. Well, if we're going through a drive-through.
If my stress threshold is too high, that's what I'll have her do. But I literally can't repeat it. I was actually just the other day, I was so proud of myself. I ordered it. My wife didn't correct me. I was like, oh, you see that? I got your order. She said, you said it wrong. God damn it.
I actually, I don't drink Starbucks, but my wife loves to drink Starbucks. So whenever we go there, I make her order because it's way too complicated. I can speak fine and I can hear what she says. It's just, nope, you can order that thing. You just do it.
Yeah, I was just curious what your thought on it was, because now, from what I see, like I follow like ADHD forums and stuff, and some people go on there and be like, I think I have it. And then everyone says you have to go to the doctor and get assessed, which of course that makes sense. But then I wonder, like, what does that involve? Can you even fake that? If people are doing it in prison, how do you fake that?
Well, that's the thing. People try to fake it.
Yeah.
But there are, like, it's not just a survey. It's not just a, whatever it is, BuzzFeed or whatever survey on, if you have these symptoms, you might have, like, that's fine as a place to start. And it's entirely fine and encouraged to go to whether it's your primary care doctor or psychologist and say, this is what I think I have. But then you need to let them do the diagnosing, because the thing about diagnosing yourself is that you sit inside your own head almost all the time. And so you lose perspective on how you compare to the general population. And self-diagnosis is not really reliable to begin with, and especially not if you want to take meds. And so, like, my ADHD thing is that this happened. So it was 2016 that I developed epilepsy. And in the next 4 to 6 months, I was finding some of what you're saying, the auditory processing, I couldn't, and I was having weird memory lapses and forgetting to do things that I normally would do. And then I would hyperfixate on other things that I normally could let go of. And just, there was a personality shift there. And because I have a background in psychology, I decided I'm going to self-diagnose, and I think that I have early onset Alzheimer's.
Yeah, that's a bit
different. And did that work for you?
A lot of that fit. A lot of the memory issues and the anxiety and the sort of the sundowner tendency of the symptoms getting worse after dark. And so I went into my neurologist, and I'm a mess, and I think I have this thing. And he's like, all right, well, let's start with having you assessed. We have a neuropsychologist right here in the office. We have a clinical psychologist right here in the office. Let's start. You sit and you talk with them. And some of it's a talking interview and some of it's tests. Some of it is self-report stuff, but there are also actual tests,
Mhm.
intelligence tests, card sort tests, the Rorschach, things like that actually help figure out whether you have it. And I don't mean the Rorschach in the Freudian, I'm going to determine what your sex life is like based on what you see here. It's a whole different way of using the test, but it's been sort of more scientifically backed.
Yeah.
Than that. And so I went through all of the testing, and toward the end, the psychologist was like, I'm going to have to take a couple of weeks to write this up, but I can tell you your diagnosis right now if you want. And now I'm sitting there like rocking in the office chair, like, I think I hear my mom calling. I gotta go, Okay, fine. What is it? And I'm braced. I'm ready because there's a history of Parkinson's in my family. And I was like, I'm terrified that it's going to be some sort of neurological whatever. Plus, epilepsy, scary.
Yeah.
And he's like, you have ADHD. And my experience with a lot of diagnoses, either giving them or receiving them, is that it goes through sort of the stages of grief.
Mm-hmm.
With stage 1 being bullshit.
Yep.
And I'm driving home and I'm like, I don't have that. That's not. Wait. Oh shit, I do. I have that symptom, and I have this symptom, and I had. Son of a bitch. I hate it when somebody else is right.
I thought I was right so much.
I actually, I don't know what it would be like to go through life not having it and then having it. Just the way that I think is just the way I've always thought. But I don't go to the doctor now for it because I can't remember the symptoms enough to talk about them. I'd have to write them down. And then that gives me reservations. Like if I wrote them down, that looks like I made like a checklist that I have to make sure I hit. And then I just go down the rabbit hole, get distracted, and never even make an appointment. So, yeah,
and talking on the phone is the worst.
Oh,
I hate talking on the phone.
I actually don't mind talking on the phone, but I will I can't focus after a couple minutes, and people will notice that I'm not actually saying anything anymore, and I don't even realize it. It's not a fun time, but I do appreciate the nonlinear thought process. I'm very good at connecting things that wouldn't normally be. I'm just not good at remembering them. That's it. There's other things, but that's like the big part of it.
That's why podcasting has been ideal for me. And that's why I started my podcast thinking that it was going to be very forensic psychology. I was going to be very lecture-y, sort of. I used to teach, and so I was going to do that and explain that forensic psychology is not like profiling, and here's what it is like, and here's what schizophrenia is not like, and here's what it is like, and things like that. Like that's what I thought, and I'd hit 10 episodes and I'd burn out and be done. 370 episodes later, I've changed my approach because I realized what I'm best at is connecting with people and following a conversation and letting it go where it goes. And that means letting go of a plan, of a script or a structure, and just being like, let's see what happens. And apparently my gift is asking people questions they didn't think I was going to ask. And so I try to warn them of that before we actually record. Like, look, you can tell me no.
Yeah.
You're not promising anything here. So
we've had to start with like, hey, is anything off limits? And even then I'll push the buttons and I'll come around anyways. I don't know if that's a dick thing or not, but it happens.
But before we move on to actual forensic psychology, how do you feel about having ADHD now when you didn't before? What's that transition like?
It's a lot at first because I have a pretty good poker face. And so I still look the same and I don't appear distressed to my loved ones. And so there was probably a year's time frame where my husband or people who knew me since childhood or whatever would assume that I felt the same because I looked the same. And it took a lot of being able to identify how I'm different, which means being able to remember how I used to be and now describing how I am now and talking through, like I have to describe all of my symptoms in minute detail to help my family better understand who and what I am now. instead of constantly trying to be who I used to be.
Which,
So
I mean,
it was rough.
You're in a unique situation where you can do that. There's so many people out there who couldn't do that. And I mean, families fall apart for things like that, where it's just,
I know a lot of people that have it. They can't even keep a job. So I'm fortunate in that respect. I can't remember what it's called. There's a name for it, but I think it might be masking, where you appear 100% normal. I think.
I don't appear normal. Like, let's not go that far.
Well, like if you're out in like if we were at a meeting or whatever, which Grizz and I have done meetings together before because we used to work together. I would be surprised if anyone even it crossed their mind that I have that, because I'm just used to masking, because it doesn't benefit me to have it out in the workforce. So I just try not to. It's just, I thought that was interesting. I just wanted to get your take on that, because I've never met anyone that didn't have it and then had it.
It's a rough go. And now I feel like I've kind of hit a new normal, and I've let myself be. And there's still days where I have to articulate something to my husband about, for instance, physical touch feels different to me. Like I don't like jump scares, and I don't like to be, which, I mean, I have 4 kids, so like the unexpected hug, I don't like that. And I've had to teach my kids a lot about consent, which ultimately might hopefully keep them out of prison. But it's been this whole process where, moms are sort of used to saying, like, we put our kids' needs first. Because moms are great. I've always been kind of an asshole anyway. So there's that. But, sort of really, there are some days where I really have to explain to my husband, like, here's where I'm at today.
Yeah.
And I cannot make this phone call. I need you to make this phone call. I don't know why it's bothering me, but I can't do it, and it needs to be made. And luckily, he's a pretty good guy, so he does the thing, and that's cool. And I've also been delighted to learn that none of the things that I used to say to children and their parents when I was running the clinic is coming back to haunt me.
That's cool.
So, big relief, let me tell you.
Yeah.
Now, doing the forensic psychologist stuff, what do you come across the most? Is it ADHD? Is it schizophrenia? I mean,
a tremendous amount of normal.
Yeah.
Like, anybody could end up in prison.
Oh, absolutely.
It's a conglomeration of the wrong mood and the wrong, the misunderstanding and the wrong set of experiences. Like, the vast majority of people who are in prison did not wake up that morning and think, I'm going to do a thing today.
Yeah. Wrong place, wrong time.
It's just, literally shit happens. And so the vast majority of people who are in prison don't need to be on meds, don't need a diagnosis, that sort of thing. And a lot of my job on the pre-prison side of things, on the assessment side, felt not pointless because somebody has to do it, but you or your kid or arguably your dog could adequately be a forensic assessor under many circumstances.
Not my dog.
Because, for instance, the figuring out whether somebody is competent to stand trial. In order to do that, you need to be able to communicate with your lawyer. That doesn't mean you do. It just means that you're able to.
Yep. Okay.
You need to be able to differentiate right from wrong or understand that what you did broke rules. Again, doesn't mean you never break the rules. It just means that rules are a thing. And you need to basically understand the court process. The roles of who the judge is, who your lawyer is, what the gallery is. You need to know that you're not supposed to jump up on the defense table in the middle of trial and take a shit, for instance. Like, these are important things. That's a pretty low bar.
It is. I gotta imagine there were still periods where that might be difficult, though.
And, no, for the most part, like the reason a lot of people are not found not guilty by reason of insanity is because they never even go to trial in the first place. So if someone is found NGRI, not guilty by reason of insanity, then usually they're sort of on a borderline, or they're good at masking, or they're real good at faking. But hopefully I'm better at figuring out when you are.
Did you run across any where you were later on, you were like, that person was masking or they were faking it?
Oh yeah. And my only job then is to share my opinion in the court, because I was an employee of the state. I was not hired by either the prosecution or the defense. Some states have that, and as well, there are private practitioners who can be hired, and that's fine. Like, there's nothing wrong with that. It's like having an expert witness of any other kind. But my job was for the state, and so I wasn't asked to reach a conclusion or spin a conclusion.
Yeah,
I was just asked, what's your opinion? Yeah, what's their diagnosis? Are they competent? And what do you think should happen next?
Interesting.
Now, when they say, what do you think should happen next? Does that mean, like, should they stand trial? Is that what they're asking you?
Sometimes should they stand trial, or if found guilty, should they go to prison or a psychiatric facility? Should they be... Now, I also did not prescribe. I opted not to pursue that option, although I think if I had remained in the field, I eventually would have gotten at least like my NP or something to become a nurse practitioner, because it holds more weight if I look at you and say, I don't think you need meds, when I can prescribe for you.
Right.
Yeah.
That makes sense.
Right? Whereas if I say I don't think you need meds and I can't prescribe for you anyway, that means nothing. But still, if I think that somebody would benefit from medication or a medication evaluation, then I would refer them accordingly.
It's my belief that we're kind of getting, as a society, we're kind of going away from meds a little bit to a degree. I was going to say, do you feel that same way when you were last doing the psychology stuff, or was it still charging strong?
It was still charging. It depended on at what point you were coming in to the process. When I was doing reevaluations, or just sort of double checking in, how are you doing? Double checking. Sometimes a diagnosis might be in question, and so I would be asked to treat it as though they'd never been diagnosed before and see if my findings matched prior findings.
I know so many people who took this stuff and they'd either be zombies, or it would change them completely to where they wouldn't want to do it anymore. Well,
and that's part of it. Is like, so for instance, bipolar disorder it's not happy sad. It's not manic depression. There's a reason that those phrases have been phased out. Bipolar disorder is depression is like your motor runs too low, and mania is like your motor runs too fast. So that's not, you may look down or you may look up, but that doesn't mean you feel it. But the thing is, when you are in a manic episode, a lot of times that feels pretty good.
Yeah. Especially, I was just saying, manic is good. That's happy.
Compared to, well, it's not happy, but at least it's up. At least you feel functional, whereas when you are in the midst of a depressive episode, you can't get out of bed. So you take the meds, it will move you from a depressive episode either to baseline or into mania, depending on what where
you started.
Yeah, exactly. And so then you get somebody who starts to move up into there, and they're like, oh, I feel fine now. I'm going to stop taking the meds.
Yeah, which is like all of them.
It's a lot. And it's super dangerous in a lot of ways when that happens. And it's very, very important for an accurate diagnosis to be given, even if it's a question of, is this depression or is this bipolar? Because if someone has depression, they take antidepressants, which takes your whole baseline mood and tries to lift it up, right? If you have bipolar disorder, the goal is to raise the lows and shrink the highs. It's a mood stabilizer, right? So you don't want to give an antidepressant to someone who has bipolar disorder, because what it does is it takes their moods that range high and low, and it shoves them up, often, spiking them right into a uncontrollable manic episode, which often involves psychosis and all kinds of other miserable experiences.
Yeah, knowing several people in my life, they have mental health. I think everyone does, where they'll have I don't know if you call it a mental health illness or whatever you want to call it nowadays. How hard is it or how easy is it to misdiagnose to something that, you know what I mean? Like, so many people I know where they've been diagnosed with bipolar, but then later on it'll become PTSD, or it's depression. Like, it's almost like they're bouncing all over the place depending on the doctor they go to.
Depends on the doctor. Exactly that. There is a reason why we have psychiatrists, psychologists, and therapists. I have no interest in psychiatry. I don't want to prescribe. I was only going to pursue an NP so that I could more accurately make suggestions. But at the end of the day, that's not, I don't think the brain is the issue as much as the environment and learning.
Absolutely.
I have no interest in doing therapy because I'm a shitty therapist. I am not patient, and I don't want to hear about your problems.
Yep.
That
I don't
is
like
my
whining either.
I'm okay with a good solid whine if it's deserved, but navel gazing, or like the refusal when you just kind of sit around and you stare at your stomach and you're like,
oh, okay,
woe is me. And I'm like, there are
life is miserable.
Who tolerate that well. I don't.
I would be fired immediately.
I had, when I was working, because you have to work as a therapist for a certain period of time. And when I did, at least 2 people went directly from my office to my supervisors because I told them, I think maybe you don't need therapy.
That would be the first 2 people I saw.
And they were like, they were pissed. And I was like, and I've since learned how to word it differently because it's not about saying you don't have problems. It's about saying therapy is not going to help you.
Everyone has problems. It's just how you cope with them. Yeah. It's how you deal with them. And so many people have repressed or just completely muted their issues because they thought that was how they deal with them. And it's not. You have to actually face these things.
Right. So I'm not a good therapist. I'm not patient. And it was funny. It would happen routinely, especially in the ER, because if I was doing an assessment in the ER to sort of determine, like, can this person go home or do they have to immediately be admitted someplace? I don't have time. I literally don't have time because for every person that I'm sitting with, I know that there's 4 lined up behind them.
Oh, yeah.
So I have maybe 4 hours total with that person, as opposed to like an in-depth forensic assessment is probably 20 hours. Total. So you shrink in that way down. And so I'd start talking to somebody and pretty quickly it would be sort of a yes, no, either here's a referral to substance abuse treatment, here's a referral to outpatient mental health treatment, or look, I can't send you home. So here's what's going to have to happen next. And once in a while you get somebody who starts sort of either lying to me or gaming the system or not understanding it or whatever it may be. And they would kick back in their ways, whatever it may be, getting snotty or getting angry or getting, tuning me out or whatever, like however people react. And that's all fine. But my answer would be, you're wasting my time and yours. I'll come back later. And they'd be like, no one has ever said that to me before. No one has ever been this honest with me before. Will you be my therapist? And I would be like, thank you. And no, you would hate me. Like, you like it because it's new and different and novel now. But you would hate it as a therapist. As a therapist, you need patience and you need some nudging, but you need to make the changes in your own pace. And I've never been patient.
You do and you don't, because there's so many people in that situation who a lot of it comes down to the fact that they need to hear things that they don't want to hear. And they have to deal with things that they don't want to deal with. And so, patience is great. But at the same time, I mean, with people in my life, there are times where I'm sitting there and I'll listen to it all. And all right, fine. And other times where you're just like, okay, enough. Pull on the pants. Let's go. Like, we have to deal with it today,
Well, and that's the thing, though, is that as a good therapist, your job is to do the similar early stage assessment stuff where you're effectively climbing into somebody else's brain. But then you back out. And as an assessment person, I back out and I say, here's what I think has to happen next. And I'm going to go write up the paperwork, because there's always paperwork. A good therapist,
especially working for the state.
for real. And a good therapist stays with you. And while they've been sort of wandering around the guided tour of the inside of your brain, they figure out how to communicate with you. How to say the things you don't want to hear, but in a way that you can tolerate it, so that you'll come back. Because otherwise you'll have a lot of first sessions and that's it.
Yeah, you also have to say it in a way where it'll click, right?
Yeah.
So when you were doing these assessments, did you ever come across a situation where it became a situation that was dangerous for you? Right? Or maybe not necessarily dangerous, because it's probably controlled, but did you ever run into anybody that really scared you?
Sure. More in the hospitals than the prisons, because in the prison, they've already been adjudicated. They've already been through the system, and they don't want that tacked on. So the prison was mostly fine. I did interact with some serial killers and some people who were legally sane for sure, but we're going to have them assessed just so we check all the boxes. So that happened, and that was awkward at best. Were there times where you're like, okay, you were literally found with a human head buried in your backyard, separate from the body. That was a literal thing that happened. Do we agree with that? That's what happened. What am I supposed to ask you next?
Yeah. Like, where do we go from here?
How do we go here from here? And you ask that. Like, I'd be very honest with them about, like, are you able to recognize that that's not the kind of thing you put on a resume?
Yeah, you have a human head in your backyard. Resume. What does this picture look like to you?
What might this be? Yeah.
Did you kill small animals as a child?
The only times I was ever injured on the job was when I was working inside locked psychiatric facilities, which was, I did both in New York, New Hampshire, and Massachusetts. You have people there who are more profoundly ill. Often there's some experimenting going on with the med levels, because we want to try and back people off meds when we can. And sometimes they back them off too far, and that's not necessarily great either. Finding that sweet spot is very difficult. So I got caught in the middle of things a couple of times where they weren't going after me, but I happened to be a corporeal body in the hallway at the same time as them, and physics happened. So that happened. In terms of a sense of threat, really only one comes to mind specifically. And I do have to be careful on confidentiality for this one, because to my knowledge, this individual, let's assume it's a woman and let's call her Rachel. I can remember those things. And so she may still be in the hospital, but probably not. So I'm gonna act as though she was sitting next to me, although please tell me, if that happens, because I should be alone in my basement right now. I just want that out there. But this woman, Rachel, developed an obsession with actually one of her college professors and started stalking. And in there's, we think of stalking as a romantic thing, but there's actually a lot of flavors of stalking. And sometimes it's actually scarier when it's not romantic in nature.
I feel like stalking is only okay in a romantic comedy. Any other time, it's sketchy.
Even then, having dealt with this woman, and then I actually have because of my podcast, I have a stalker with a restraining order and everything. So that's a whole other story. But
good times.
Yeah, no, actually, some of it was pretty funny. But this Rachel woman developed this obsession with a professor.
So if it wasn't
Yeah.
romantic, she was just stalking them because she hated them?
No. She was. It was a positive. Well, positive in her mind obsession that she felt that this professor was speaking only to her.
Oh, one of those. Okay.
Okay.
And it was actually a same-sex professor,
Gotcha.
although I don't believe that there was any sexual component to the obsession. I believe it was about like, this is my best friend. She
Gotcha.
wants to be my best friend or is my best friend and just doesn't know it. And she cares about me in the way that nobody else cares about me. And so I had to go through and do an entire assessment battery, which means a whole bunch of tests and a whole bunch of interviewing for her. And you have to maintain that poker face because sometimes she's saying things and you're like, bullshit, but you can't say that to the
See?
person,
Fired.
you know? And as well, I needed to be able to gather information to testify in court because my opinion about her was that, yeah, she's, to get with the jargon, she's fucked up, but
Batshit
not
crazy.
in a way that, yes, batshit crazy, but not in a way that's uncontrollable. Like, we can let her go home. Please don't. But like, she could attend to her personal hygiene and she could pay bills and make appointments and she could drive a car. It's just that she's also batshit crazy. And so she doesn't belong in a psychiatric hospital. She belongs in jail. And that was my opinion. And I had to be very, very careful on how I broached that. And maybe 12 or 14 hours in to this pseudo relationship that she and I developed, she asked me, what do I think? And I answered, I don't know. Because I am under no circumstances. I was in a room that was maybe 8 by 6. It was an enthusiastic closet is what it was. And I was not going to look at this woman who has already developed a dangerous and threatening obsession with a professor and tell her, I think that you have a personality disorder and that you are a dangerous human being and that you should be in prison, not here. I'm not going to say that.
I don't think you'd ever really want to tell them. You're always just like, I'm gathering evidence. It's fine.
Yeah. Well, I mean, because I had to say it in court eventually, but I'm not going to say it when there's no witnesses around. And she, so I said, I don't know. I don't have a solid sense yet. We still have a couple more tests that we got to go through. Can we start that? And she stands up and she leans over. We're this like crappy industrial aluminum desk that they made, you know, all of them in the 50s, and they're still just out in the wild now. Yeah. She leans over that and she grabs hold of I had my ID badge on a lanyard, and she rips it off of me. And so she's like, I have you now. I have your identity now. You have to tell me. And I'm going, this is not how I expected this day to go.
That took a turn.
And so I was just like, you can have that. That is fine. All I had was my first name on it anyway. And when I practiced under my maiden name rather than my married name, because my married name is weird.
Was that a conscious choice? No, so that was the only reason, not for like safety or anything like that.
Oh, it's for safety. It's because my married name is weird. And we are one of the only Wallinga families in the country.
Hey, so Wallinga's your married name?
Yeah.
See, before the show, we were talking about your last name, and I was like, man, I wish I had a cool last name instead of the shitty one that I got.
Well, it's Dutch. So, you know, we are not the Flying Wallendas. It is Wallinga. And so I lived my life under my married name, but I practiced under my maiden name, which was much, much more common. And so I was like, all she has is my first name. But even if she were to ask around or get hold of the the paperwork, which she would eventually through the court process, she would get my married name. And if she wanted to pursue it from there, we'd deal with it.
Yeah. Now, what did she do for this all to go down in the first place? I know she was stalking, but like, did she take it a step further?
She called and emailed and started showing up at the professor's home. And that was disturbing. And then she started sending these videos. And now this is in the late 90s. And so you have to picture camcorder.
So you get a
VHS
VHS tape in the mail.
tapes,
That's creepy.
right? And it was
small ones.
the equivalent of selfies.
Yeah.
Right. And it was her speaking directly to the camera, speaking directly to the professor about, this is my last will and testament. I am dying and you need to know these words that I'm telling you. And in the background, well, first of all, she had right here, she had what would have been, it's called a hep lock or a PICC line, which are durable IVs, basically. And except if you looked at it, it was on wrong. It was on upside down. So that wasn't great, but that was helpful. Like, it's helpful when people screw things up. And also, if you looked in the background, you'd notice that she was standing outside the professor's summer home.
Okay.
Which she had no reason to have had access to that.
Oh, man.
Yeah.
Could you imagine watching that and be like, this looks familiar? Oh my God, that's my house.
That's
Oh,
my
I can
house.
think
That's
of
where my
right now.
kids are. That's where my dogs are. That's where my, whatever.
Yeah.
And so that was disturbing. And she wouldn't stop. And there were restraining orders in place. And she wouldn't stop even then. And she ended up starting to vandalize some of the professor's belongings. Flattened her tires in her car and keyed
So things
her
were
car.
escalating.
She went full on Carrie Underwood on the woman's car, basically.
It makes me think of the movie, it was like mid-90s, Fear. Do you remember that?
Yeah. Yep.
Right? Mark Wahlberg.
Yeah, he beat the shit out of himself to make his case. Yeah.
Just go fucking, I mean, that's a romantic comedy gone wrong, but
I mean-
like
So yeah, that was disturbing. Dealing with her was disturbing, because if she's willing to do that to one person, how do you know who she's going to choose next?
Yeah.
Now, I gotta ask, how is the serial killer stuff? That's got to be fascinating and terrifying.
They're friggin' hilarious for the most part.
Really? How so?
I mean, they have to mask. Like, you talk about masking.
And
like,
they're probably
that's-
really, really good at it.
You have to, because now bear in mind, all we know about, we don't know shit about serial killers, and this whole concept of like the McDonald triad being, someone's more likely to be a serial killer if they wet the bed, set fires, or are cruel to animals. We don't know. The only serial killers we've ever talked to are the failures,
That's true.
the ones who have gotten caught.
It's got to be a lot harder to be a serial killer nowadays, though.
I hope so.
You know what I'm saying? There's way too many cameras.
I do hope so. But that being said, like they have to think on their feet. They have to be some form of charismatic. And a lot of times when we think charisma, we think like engaging or intriguing or somebody you really want to be around when you talk to them. Not necessarily. Sometimes, like, there was a guy in Poughkeepsie, New York, who I did not work with at all. I didn't practice in this area, but he was known for having such abysmal personal hygiene that people didn't want to get within 10 feet of him. That solved a lot of problems for him. Right? Because people didn't get near him and people didn't get near his house, and he could do whatever he wanted inside his house.
That's true. Yeah. And they're
so
used to bad smells.
There's different sort of ways of they consider it their life's work. It's like their masterwork.
Yeah.
And there's different ways of getting done what you want done, but so they're always unpredictable, and making assumptions is always a bad idea. But like, the most fun, hands down, the most fun I ever had at a job was a day that I had to testify in court for a reevaluation of a guy who had been convicted of, I think, 4 murders, but suspected of several more. And he knew what I was there to say. I told him. I didn't lie, because I didn't ever want there to be like a courtroom standoff kind of thing. Like, I would sit them and explain to them, this is what I'm seeing. This is what you're going to see me say. If they wanted to hear it. If they didn't, I was like, whew, and then go. But so this guy, he knew that I was going to say that he is guilty as fuck. He is, guilty with no apparent legal insanity. and send him back to solitary. Like that was going to be my opinion. And he was like, that's fine. I'm just looking forward to going to court because I'm looking forward to getting out of the building for the day. And I was like, you have a different idea of fun than I do, but I think we'd established that already. Fair. Okay. And so it's sort of like chain of custody where like someone has to be with them at all times to prevent potential escape, but also just sometimes they get bored and they'll start confessing to things. And I used to hope so much that they would not confess something new to me.
Yeah.
Because I'd be like, I just want to move on from here. Like, please don't tell me things.
I've had to be a witness in things, and that sucks. I hate that. I don't wish that upon anyone.
And so I was just, just sort of sitting there with him, and I'm like, my friend, you're not going to confess anything new to me today, right? And he's like, oh no, I've already said all my shit. I just want to go back to my cell eventually. I'm just enjoying my little field trip. And I was like, okay. Now what? And he goes, what did the farmer do? What did the farmer say when he lost his tractor?
What?
What did the farmer say when he lost his tractor? And I'm like, I am not keeping up with you right now.
You're on a different level.
He said, where's my tractor? And I spent the next 3.5 hours trading dad jokes with a serial killer.
There you go.
That was how I spent
Jerry would have laughed his ass off.
Yeah. Well, it would have taken me a second to understand what he was talking about. Like he said, where's my tractor? I'm like, that's not a joke. Oh, now I get it. Yeah, because actually, if you talk about dad jokes, some of those seem pretty psychotic.
Well, for real.
It's all in delivery,
Why don't
man.
cannibals eat clowns?
I don't know. Why not?
I think I know this one.
Because they taste funny.
That's it. Actually,
right? There's
my favorite one to
right
use.
That.
My favorite one to use on my kids is we're driving by a cemetery. I'll point out, like, you guys see that? Yeah. People are dying to get in there. I love that one.
My favorite.
Thank God I'm not your kid.
Is more of like it's not so much a dad joke as like the shaggy dog joke, where it's like weird and long, and I won't go into the whole thing, but the punchline is one that I will now just randomly throw at my kids at moments.
Yeah, because they've heard
it. What's that?
Because they've heard it before? So they've
heard it 1,000 times. Yeah. And they know exactly what it is, but so I'll just randomly throw that at them with no context or anything. And they'll be like, we like dad's jokes better. And I'll be like, good, get out of the car. Like, that's the answer.
We have to have the conversation way too often in my household that my oldest is not funny and that my daughter, my middle child, is the comedian. Like, he can't get it. He tries to come up with jokes and we're all sitting there like, that was awful. Stop it. This is painful. You need to stop.
Yeah, but my daughter does the same thing. She's younger. She'll just spit out what she calls a joke, and I'll be like, that was just a statement.
But she's young enough that she doesn't understand that yet. He's 12.
That's actually,
he knows what comedy is.
I'm giving her false reinforcement on that because I think it's hysterical how bad she is at jokes. So she thinks she's really good at it.
Watch, she's going to become a comedian. It's literally just going to be her not telling jokes. People are going to love that shit.
So, serial killers. Have you ever seen this picture behind me?
Yeah, but I'm not a neuropsychologist.
The one on the left is a bat. The one on the right is a chicken.
Yes. Now, I know you're not, but I just put this up because I thought it was interesting. So an article that Grizz and I read some time ago. They did some brain scans on serial killers, right, Grizz?
Yeah. So they did brain scans on them, and they found that the front cortex, I can't tell you what that is, didn't have activity in it.
Mm-hmm.
But they also said that, like, someone like me, I'm not a serial killer that you know of, could have the same thing but not be a serial killer. They said all serial killers wouldn't have it. See? Exactly. Mm-hmm. So all serial killers had it, but you could have it and not be a serial killer.
All of the failed serial killers that self-selected to be part of their study.
That's true. There's probably a lot of really successful serial killers where it's fully active.
Well, so what's fascinating about this one is the guy who was doing the study said, I'm going to scan my own brain.
Robert
he had
Hare.
it.
Yeah.
Yeah. He's like, shit, am I a serial killer?
Well,
psychopath.
You're usually pretty aware of that because burying bodies takes work. So like getting your body disposal is something where you don't forget as easily. But I tend, I'm not full on psychopathic. Like I can experience emotion. I do have bonds with my loved ones and that kind of thing. But I also can distance myself from situations and not take things personally and think of things in a more clinical, removed way than average, which is what allowed me to do my job, but also could have allowed me to end up on the other side of the courtroom.
Now, have you always been that way?
Maybe.
So the reason I ask is because I can kind of behave the same way.
I think a lot of people can.
Yeah, I know a lot of people can, but we were on the topic where she had a drastic change in her.
That's true.
Oh, I see. Yeah, no, for sure. No, for sure. Before I had epilepsy, for sure, because I actually started off studying mechanical engineering.
Mm-hmm.
Oh, damn.
Because I'm good at it. I'm good with technology and I'm good at numbers. And I really wanted to move out of my parents' house. And the school I went to had a program that allowed me to leave high school a year early. And so I was all over that. And I got 2.5 years in and realized it was boring for me.
I don't like math this much.
To be they give you, you got 30 kids in a room and you give them a problem, a physics problem or whatever, and you give them the same variables and the same information and they all do the work and they come out with an answer and they all should have the same answer. And you want consistency in engineering. You want bridges to consistently remain bridges and not become a pile of not bridge anymore, right? So
if that's what you're going for, yeah.
I acknowledge the importance of that, but it wasn't for me. Whereas if you've got a psychology classroom and you give 30 kids the same prompt, draw a house, tell me a story, that kind of thing, you'll get 30 different answers and they're all correct. How cool is that?
Yeah.
How random is that?
I mean, it's cool, but it's also, to me, it can drive me nuts because everything you see in your life, everyone's going to take it away differently, right? Mm-hmm. Same idea as you have 30 people who witness something go down and you have 30 different examples of how something went down, Yeah. And that could be a pain in the butt.
And by the way, on that note, eyewitness testimony is shit and don't bother.
Yeah. Haven't they figured that out? And they kind of, if it's not literally recorded, they don't worry, like they don't use eyewitness for that stuff.
It holds more weight with juries because juries believe in it.
Mm.
So it's a tactic they still use.
Mm-hmm.
But I mean, like when I know they've gone into the whole memory thing, and within minutes outside of it, your memories change. It's like dreams, right? Where you just start forgetting, and it just starts getting molded the further you get away from the event.
Yeah. Mm-hmm. Yeah. Now it's interesting that you mentioned that you were an engineering student and you found it incredibly boring. I was also an engineering student who found it incredibly boring. I actually, one of my last classes that kind of like, it was like the straw that broke the camel's back for me on that one it was like a practical class. I don't remember what it was called, but basically we were like getting assignments where this is an engineering failure, analyze it and figure out what happened so it doesn't happen again. I wanted to kill myself. That's how incredibly bored I was. And I was like, this is like the day in the life of an engineer. I'm not an engineer. I'm a people person.
That's true. Most engineers are not people persons.
I don't know if I'm a people person because I often don't like people.
I love.
You can be a people person and not like people.
I suppose that's true.
I don't like a lot of people, but I find them fascinating, and I think the big trick for me, like I was going to go into profiling.
Mm-hmm.
I was going to do full-on FBI profiling,
which is cool.
I decided not to because, first of all, I'm not comfortable having guns in the home. I have 4 kids. I didn't have kids at the time, but I wanted to, and that wasn't something that I was great with for myself. And also, you have to, first of all, you serve as a sort of garden variety, I guess, FBI agent for some period of time before you move on to becoming a behavioral analysis unit special agent. And I'm not that patient, for one. And for two, once you're in the BAU, you have to travel. Which
wherever the crime is, right?
Right. Because, that's ideal, really, because you don't actually want to live in a place where there's enough serial killers to keep you busy year
just
round.
Detroit.
But it means, well, yeah. But, I mean, I do live in Boston, so there's that. But
yeah, Boston crime ain't that bad anymore.
Well, I lived on Mission Hill. So it was pretty bad in the 90s.
It was bad for a while, but nowadays, I mean, crime in Boston's gone way down.
Yeah, well, yeah. I mean, the pandemic helped with that. Nobody leaving their house and stuff. But that for me, it was again related to I couldn't be the kind of mother I wanted to be if I was traveling 48 weeks out of the year.
Yeah, a lot of jobs like that everyone dreams of having. You can't have a family life. It doesn't work.
Right.
Your job is your life.
Yeah, funny thing about families is they want to see you.
Sometimes.
Well, more than I would like, actually, honestly. Like, there's got to be a happy medium in there somewhere. But so I decided to go into forensic psychology instead because you can live and stay in one place. And also around this time, this was in the mid to late 90s, I was starting to realize that profiling is a lot of, it's not guesswork, but it's at the earlier stages. And I didn't want to do research, and I didn't want to guess, and I didn't want to guess wrong. So did I really want to write textbooks, or did I want to go and sit down with these people and talk to them and hear their stories and learn about them? And it turns out I really, really like the latter. And I know that I'm not full on, top of the scale on the PCLR, the psychopathy checklist that you were talking about, the hair study. I'm not top of the scale there, but I'm high enough that I don't really care whether I'm right. I think I am because I'm pretty smart, but I don't really care whether a trial outcome matches what I think it should.
Yeah.
And you need that. You need that distance and that ability to get up on the stand and tell other people about a third person that's in the room and tell them what your opinions are and what your, both educated guess, but also just like, it was really unpleasant to be in the room with this human being, and you're looking at them right there and you're saying it to them. And I had to be okay with doing that. And it turns out I am. So I can do that. And that was sort of the ideal job for me. And I miss it every day.
It sounds like a cool job. I mean, if the one thing we've gotten out of this, Jerry, I don't want to speak for you, but I believe it's true that it's
Go ahead, speak for me.
Everyone has a story, and it's fascinating to hear. And when you get into stuff where they're like committing crimes and stuff, makes it even cooler. I mean, that's why crime does so good on TV.
For real.
Serial killers are fascinating and terrifying.
I'm glad you spoke for me. Now I don't have to say it. You're right.
See, I already knew.
I actually think after having spent quite a bit of time with Grizz, he would probably register pretty high on that scale too.
Oh, probably.
Yeah. He just doesn't.
I can be very just not give a fuck. Like, who cares?
Like, you can see something. Oh, that's problematic, but I just don't care. That's Grizz.
I've been there. And, the number of times where I've looked at my children and been like, "Look, I love you because that's the rule. I have to, but I don't like you right now. And I also don't care what you do. So you figure it out." And I mean, none of them have been. Actually, I lie. One of my children has been in the back of a police car. That's my youngest, who was 7 at the time. So that was the thing.
This sounds like a fascinating story. My problem with life, and I feel, and maybe, I don't know if we're getting away from it or if we're getting worse. There's so much stuff that people won't say because, society says you can't say that, right? I remember a friend of mine, they really, really wanted a boy, and they had a bunch of girls. and they got pregnant, and there was another girl, and she was the woman was upset that they weren't going to have a boy, and she's like, I shouldn't be saying this. I'm like, no, you absolutely should. You're thinking it. It's in your brain. Like, it's okay. That's not a bad thing. Just because society says, oh, you shouldn't say that, you're still going to love the kid no matter what the hell they are. And listen, I guarantee most people have a period when they have children where they really feel very indifferent to it. Later on in life, they change their mind there and they realize, oh, I love my children and I took care of them for a reason. But I think everyone has that moment where they're just like, I'm doing this because I'm supposed to, but that's it.
Anybody who has ever sat through a middle school band concert
Oh, God.
understands what regret feels like.
So true. That and ballet. Ballet, listen, the 5 minutes that your son or daughter or whatever is on stage are great. The other 2 hours, miserable. Absolutely miserable. Just kill me.
I'll be the first to admit I love my kids, but there are many times where I say to myself, man, having kids fucking sucks.
Oh yeah, there's more good than bad, but you know what I'm saying? Like there's so much out there where people won't say something because they're not supposed to. When realistically, I think they should be saying it. I think it's healthier to say it. You know?
Yeah. I don't buy the bullshit where a lot of people are like, being a parent's the greatest thing on earth. My opinion is
fuck that.
My opinion is being a parent sucks almost all the time, but I think it's worth it.
I mean, my oldest is 21, my youngest is 9. And so I have this whole range of kids. I've been a parent for longer than I've been alive, if you add their ages up by now.
Mm-hmm. Yeah.
And it's work. They're thankless little beasts with terrible personal hygiene. They don't clean up after themselves. They don't listen. All they want to do is be on their fucking screens 24/7. Like, they have all of these, like, they're just narcissistic little dicks. And I love them because I love them, because I do feel a bond, and because I will go full on mama bear toward anybody that threatens or harms one of my kids.
Oh, absolutely.
That being said, love is automatic, like is earned.
Yeah,
and I've said to my kids, like, you are not trying to make me like you today. Let me know when you change your mind. But right this second, you don't want me to like you. And guess what? You've succeeded.
You probably don't like me right now either.
Which is totally fair. I'm not especially likable half the time. That's entirely allowed.
Yeah, I actually, I have a very maybe controversial theory about kids. I like kids. I think they're entertaining. I love watching videos of kids saying fucked up shit. Like yesterday, I watched a little kid say he's going to uppercut Santa.
That's fantastic.
But I firmly believe it doesn't matter how smart your kid is. They're all so fucking dumb. And that's where most of that entertainment comes from.
It's true.
So, kids ruin everything. I mean, they just do.
Yeah. All the time I walk into a room where my daughter is and just say, why? Why did this happen?
What the fuck happened in here? Like, what? Yeah. And I mean, there's times now where I'll just walk in and be like, do you need me to say it?
Yeah.
Like, no.
You know better.
Good. Fix it.
Yeah, my daughter's still at the age where she knows that that's how I feel, but she will not act on it unless she's told to. That's a 7-year-old for you.
I have to imagine your daughter loves testing the waters.
Listen, I've never seen such a thing before. She might be pretty high on the psychopath scale. It's absurd. Like, I watched you do this. Did you do that? It wasn't me. I didn't do that. Okay.
My youngest is also psychopathic. She's adopted.
Yep.
So, insert a long story here. I died in childbirth after the third. And I undid it. Like, I'm not still dead, by the way. But I told you, medical shit happens.
Seriously.
So, someone in the delivery room had strep throat. That got into my bloodstream during the birthing process. And if you've ever read the tabloid reports of necrotizing fasciitis, the flesh-eating bacteria, I had that abdominally. So I spent a week and a half in a coma, and 6 weeks in the hospital, and a full year on home health care. So
I now know why you live in Massachusetts.
And so we had to hire a nanny, and we hired this college girl from locally who did a fine job as a nanny. Like, I feel like that's important to put out there, that she was a good nanny. She got how we parented. We don't spank or ground, mostly because that's not as effective as guilt.
Mm-hmm.
And so I err in that direction. But she got it. Like, she got how we parented and we were fine. And then I started to get better, and I got to the point where I was going to go back to work, and she started to say that she wanted to be a single mother. And I was like, are you high?
Terrible.
Like, I understand that people do this when they are well established in their life, or people do this when shit has gone in unexpected ways. But you're 22.
Yeah, that's not something you want.
You have no life skills, and your family has stopped speaking to you. Like, look, you're going to make your choices, but we're moving, and the new place that we're moving to does not have an in-law apartment, so good luck with you. I'm putting my kids in daycare, see ya. And that's how it went. And 2.5 years later, like, we'd been in touch a little bit on Facebook, whatever, and so I got like the Disney version of what was going on. And 2.5 years later, she calls me in the middle of the night to say, I need help. My family has stopped speaking to me. I am living in one of those motels that rents by the hour or the month. I've broken up with the guy that I hooked up with. She hooked up with a guy 2 weeks after the baby was born. Not the biological father.
We got a good scenario going on right now.
You know, and this is legitimately one of my favorite sentences to speak aloud. Like if I could write country music, it would involve this line, because she said, I just lost my job at the mayonnaise factory. Can you imagine what that smells like in August in Massachusetts? Like, my God. But for real though, she was like, I'm hitting a wall. I need to admit myself to the psych hospital. Will you take care of the baby? Of course. Like, you know, my mindset has always been like, if you can help, then you should.
Yeah,
absolutely.
And that way, if you can't, then you say, no, I can't do it, with no guilt, but we could. And the next day, so we got the baby set up in the pack and play. I sort of nudged my husband awake, and I was like, there's a baby.
That's a bad wake up.
In your office, just so you know. And he said, and I hate when he's right, man. I hate when they're right. And he's like, should we just jump ahead to the point where we adopt her right now? And I was like, shut up. That's not going to happen. That's not going to be a thing. Well, 4 months later, we had to assertively uninvite the biological mother from living here anymore. That turns out that DCF had an open case, and had since the baby's birth. The child has been abused in every way you can hurt a child. And the mother was actively sabotaging. She had a personal therapist, they had a family therapist, she had a person helping her find jobs, she had another person helping her find housing, like all of these systems around her, and she was still actively sabotaging it in ways. And so I was like, you got to go. Like,
sabotaging what? Like her
quitting
life?
Jobs, getting hired, or getting fired rather from, if you can find a way to get fired from one of the big box craft stores in December, I don't know what you're doing at your job.
Stealing shit.
But that takes some work. Right?
Yeah, I know plenty of people who work harder to not work.
That was her. Like, for the most part, I feel like people who are on welfare or state assistance are on there because they've hit a rough point and they need some help and they move on. That's what I expected from her. And in this case, no. She's the horror story that a lot of people like to point at as like, this is why we shouldn't have welfare at all. And I was like, again, happy medium. But after several months, I learned that she was in the process of sabotaging yet another job, and she had just declined another housing opportunity, and that she had tried to steal all 4 children's identities and was engaging in sex work out of my home. And I was like, I don't know which of those is the last straw, but one of them.
Yeah, man.
Yeah, I bet.
Somewhere in there.
The whole bundle.
You gotta go. You gotta go. You can leave the baby with us and get yourself established, or you can take her with you, but you have to go. And she was like, I'll leave the baby with you. I think it'll be easier to get set up in an apartment and a job. And I'm like, that's going to happen. But okay, fine. By this point, I was already legal guardian.
I was going to say, because I got to imagine otherwise that's going to be a massive headache.
Well, and she was making really bad choices. And medically, there were some things where I had to kind of step in and speak up on behalf of the child. And sometimes the mother would go missing for a week. And the kid had some medical issues going on. And we already realized by then, like, this is a weird kid. Like a 2-year-old that doesn't ask questions. And if you ask her a question, and that includes like, what? That she would literally duck and cover because she didn't know how to deal with people communicating with her.
That's rough.
She does not have autism, although we may have her evaluated for it because that may be like a secondary thing. But her primary diagnosis is more trauma-based, is more just if nobody talks to you for the first 2 years of life, this is what happens. And so the biological mother said, I'm going to leave the baby with you. I'll go get set up. 2 weeks later, she called and said, I'm never going to get better. You keep her. And we've never seen her since.
That's crazy.
So surprise, it's a girl. And my kid is academically very bright. She wants to make people happy. She wants to do what she thinks you want her to do. But the thing is, the missing part is she's not intuitive. She doesn't get other people at all. So she's a sociopath. She doesn't understand emotion. She doesn't understand connection. And the thing is, she's trying really hard not to be. And we're working with her on, okay, well, look, if you don't understand emotions, that's cool. That's fine. There are jobs that we can steer you to down the road. For now, let's worry about your math test. And for now, that's fine. Like, for instance, if you're a sociopath, you're going to suck at team sports. And I don't like sports to begin with.
Get into wrestling.
Gymnastics was her
there
answer.
You go.
Gymnastics was her because what she likes is dress up. But she doesn't understand dress up. She just puts on all of the dress up.
Okay.
So with gymnastics, it's like, here is your outfit that you get dressed up in to go do gymnastics, to go play. And she loves that. That works well for her. She doesn't have any friends. She never has. She still doesn't ask questions in the way that you think a 9-year-old would. But that has to be okay. Like, that's who and how she is.
She had a rough start.
And I don't think I think there are some traumas and scars that you can overcome. There are some you cannot. And I think that when you have zero emotional connection or communication for the first 2 years of life, I think that hardwires in your brain in certain ways.
The first few years of your life are just so, like, they set you as who you are. You don't even know it. The first 5 years, I've always thought first 5 years. After that, so many other factors come in. Your first 5 years is what you can mold them into a person. Right? After that, the world takes over. I
don't even think we got 5 years. I think first 2, maybe less. And in her case, it became a matter of, well, we're going to do the best we can for her.
Yeah. That's all you can do.
She's absolutely a sociopath. Like, she is. And I'm trying to work. Like, I don't look at her and say, you're a sociopath, because that's not helpful. But to try to take the stigma out of that word.
Yeah.
Like, it just means, socio means interaction with other people, and path means pathological. Like, you don't interact with other people in a normal way. That's okay. Neither do I.
She could be on the spectrum. A lot of autistic people have that issue. They just don't know how to deal with other people.
Autism is something that you're born with.
Yeah, I agree.
I don't believe she was born with this. I believe this was beaten into her.
Almost like a PTSD kind of thing.
Exactly like PTSD. But that being said, we are going to have her assessed relatively soon for autism, because if she meets the diagnostic criteria, she gets more services through the schools.
Yeah.
Yeah, absolutely. Yeah, I mean, that kind of goes into this thing that Jerry and I have, where almost every woman we know of our generation has mental health issues. Every single one of them. And I don't know if that's a societal thing
or something. I don't know.
I would argue men as well. They just show it different. They appear it differently.
It's also men weren't allowed to have mental health.
Yeah.
Right. You're not allowed to express it. And so men, depression in men looks like anger.
Mm-hmm.
Yeah.
Depression in women looks like sadness or withdrawal.
Mm. Yeah, that's true. That's an interesting way of looking at it. But
perspectives from Dr. Grizz. But yeah, I guess your daughter is probably in the best place she could be, considering your background.
She's, people say that, and fine. I think what matters is that she's safe.
Yeah.
Yeah, she's in a better house.
And she's consistent and she's stable here. And we have to remind her, pretty frequently, a couple times a year at least, maybe more. We are your family now.
Mm-hmm.
Because she can remember. She can remember her biological family, because trauma memories are different from normal memories. And so she can remember things from before she turned 2.
Which is crazy.
And it's horrifying. I would erase that for her if I could. Some of the things that she can remember. But that being said, she knows that she used to have a different family and now she has us. And there's some part of her that she asks, not maliciously at all, but in a very matter-of-fact, flat way, when will I get my next family?
Mm.
That's crazy.
And we've had to be very, very clear with her about, you won't.
Yeah.
But the problem is, too, and I mean, there's a whole bunch of ways that this could unfold, but for one, she's not great with, she doesn't know what a stranger is.
Mm.
Okay.
So for children, the whole concept of stranger danger is entire bullshit.
Mm-hmm.
It doesn't exist.
Yeah.
Your kids are in vastly more risk from people that know them than from strangers. Except if an adult is looking to offend on a stranger who's a child, they're excellent profilers. Those are the excellent profilers in the world. Mm-hmm. They know how to pick a victim.
Yeah.
And my kid, I can see it. And I'm not looking to offend. And so if somebody was looking to offend, they would have to be able to pick it out, that this is a child who's very obedient and very withdrawn in a lot of ways, sort of flat affect. You don't see that there's something wrong. And she's very sort of gullible in a way. So with, the ploy that we all sort of were grown up with here, he's like, can you help me go find my puppy? And the little kid would be like, yeah, okay. And with the other kids, my other 3 kids, I would practice with them a little bit about the answer to anything that a stranger ever tells you is, I have to ask my mom.
Mm.
Just, that's the script. I have to ask my mom. And with my youngest, there's no script to give her.
Yeah, because it wouldn't make sense to her.
It doesn't make sense to her, and she doesn't there have been times, one of the times we were going to the park and we practiced on the way there, because I was going to try to let her go to a different playground. My oldest played softball, and the softball field's one way and the playground's behind me. And so it's you have to decide what are you going to do here? And so I practiced okay, what do you do if a stranger comes up and says this or that? Can you help me find my puppy? Can you help me this? Can you whatever? And she kept giving, after what, she learned the answer is, I have to ask my mom. I have to ask my mom. I have to. Okay. And so we're pulling in to the parking lot, and I'm like, one last, just to make sure we really got it. And I'm like, okay, so what if somebody tells you, hey, can you come over here? I just dropped my phone under my car. Can you kind of scooch down under my car and get it? What do you say? And she goes, okay. And I'm like, oh, son of a, but that's the thing, is that she's gullible in that sense. And so she's at a higher risk for stranger crimes if they're going to exist. And the problem that's all rooted in is that for a kid to understand what safety means, they have to be able to imagine what danger means.
Mm-hmm.
And she doesn't have an imagination. That's the easiest way I describe it to people, is that she doesn't ask questions. She doesn't have curiosity in that sense. She doesn't.
Because it was beaten out of her, in a sense.
She just sort of, everything is, she's completely literal at all times. And she can't imagine what danger means. She's already survived it.
Mm-hmm.
So for one thing, danger doesn't mean the same thing to her as it means to other kids. And for another thing, the idea of understanding the concept of danger, you need to have that before you can understand what it means to be safe. And she doesn't have that basic.
You'll have to, the other thing is, and if she ever does date and whatnot, that's the scenario where you run into those really shitty relationships where because they prey on people like that, to where they just, they make it a scenario where they just constantly beat down, because they're looking for people to do it to who will be obedient and who will just take it and keep taking it and keep taking it and keep taking it. And it happens all too often, but they're looking for people like that for that relationship, just so they can make themselves feel better.
I mean, if I can get her to 12 without using drugs,
mm-hmm.
and to 15 without engaging in sex work,
mm-hmm.
that will be my hallmarks of success.
Mm-hmm.
Mm.
Because drugs and sex feel good, and they bring you attention, and she likes attention.
Yeah.
Like,
so
in a way that,
again,
in a way more than other kids do. Like, in this, she doesn't get how to appropriately get it.
Mm-hmm.
And so I worry for her safety. And so, is she better off here than other places? Maybe, maybe not. But she's certainly better off than she was in the family she was born into.
And the problem is that story is way too often nowadays. Like, there's so many people who have kids who they should never have had kids.
I cannot believe that you need permission to get your ears pierced and you need a license to drive a car. And I mean, I'm in Massachusetts, so like, that's saying something. But you can just grow another human being with no permission. That's insane.
I got a dog about a year ago. It is way fucking harder to get a dog than it ever is to have a kid and keep that kid.
Well, and that was the other thing, is that adopting is so much more, okay, as the woman in the relationship, I can tell you that adoption is more intrusive and physically invasive than conceiving a child biologically.
Which is saying something.
Right.
And I give it to people who adopt, because it is is it a massive pain in the beginning, right? Great once you have the kid, but then you're also dealing with, there's a lot of luggage there. Like,
yes,
almost every time, if you've adopted someone, props.
For real, whether you chose to or whether, I find myself in this weird position because most people who adopt, I believe everybody who adopts in some way or other pays for it, either financially or, through their effort.
Emotionally.
Or emotional labor or whatever it may be. And we're certainly paying for it in that sense, like it's a lot of effort. But the difference is most people seek it out. I did not.
Yeah, your adoption.
I tried hard not to adopt. We tried hard to get her biological mother on her feet and wave goodbye. And it didn't happen. And, of course we could have said no, but I didn't have the heart to do that to this kid who'd already lost everything once.
Yeah. No, that's a crazy scenario.
Yeah, my former nanny. Yeah.
That's probably a great place to wrap it up before we go off on another tangent, because we'll talk for another hour.
Yes, we will.
I'll have more tangents. I always have more tangents.
That's it. Jerry has to shut me up all the time. It's just the way it goes.
But so where can our listeners find more of you?
Oh God. Well, my show is called Ignorance Was Bliss. I'm at IWB Podcast on all of the social medias, and I'm online far too much. So I'm reasonably easy to find. And like I said, I very recently released episode number 370, and I'm rolling up on 1 million downloads, which is insane.
That's
like,
cool.
What is wrong with people? But, the reality is that each episode is intended to be standalone. And they are not all true crime, and they're not all psychology. I talk to creators of different types, whether they be podcasters or authors or actors, or sometimes we do go down the true crime route and that sort of thing, and we sort of see how it unfolds.
Sounds good. I like it.
Yeah, totally. And we will direct people to you. And thanks for being on the show.
Thank you.
Well, Grizz, there you have it. Now we know everything there is to know about forensic psychology, and we are prepared to analyze criminals.
Bullshit. I'm sorry.
I actually know 100% that I would never want to do that job. How about you?
No, I think it would be interesting. I like talking to people.
I like talking to people too, but I don't know, man. The justice system's not for me. It's a mess, especially talking to criminals who like just killed their entire family, like the Ed Kempers of the world, cutting off
I
heads
think
and
I would
fucking
find
the
that
whole.
fascinating. I think most people would find that fascinating, but you're just the whole time, how can you really analyze instead of just being like,
Yeah, I wouldn't be able to analyze. I'd be like, you did
you're
what?
just sitting there going, what the fuck?
Hold on, back up. I gotta record that again. You did what?
Hold on, I gotta tell my wife about this shit.
Yeah, I'd have
What'd
a
you
hard
do
time.
with their head?
I'd have a hard time focusing on that. But she had a lot of insightful things that I thought were pretty cool. I especially thought it was interesting how she developed ADHD, which,
Yeah, you like that part.
yeah, because I think ADHD is pretty cool. It's problematic, but it's psychologically super, super interesting.
I mean, I think all mental health in general is fascinating. To
Yeah.
why we get it, to what the hell it does to us, and how we can't control it. I mean,
Yeah,
I'll take it all.
absolutely. But if you guys at home listening and watching on YouTube enjoyed that, let us know in the comments, or like and subscribe.
Thank you again for listening to Beautiful Bastards. New episodes every Monday. Remember to like and subscribe. One side of me says, I'd like to talk to her. The other side of me says, I wonder what her head would look like on a stick.
And in the words of the late Charles Manson, I'm Jesus Christ. Whether you want to accept it or not, I don't care.